Hi everyone, we'll just wait a few moments to kind of let everyone join, but thank you for joining us in the meantime. Hi, those who have just joined us. We're just giving it a couple minutes just to let everyone join. Thank you once again. We'll be with you in a minute. We'll just give it one more minute till 2-3 minutes past, and then we'll make a start, everyone.
I can see we've had a question already, Annabelle, which is great. Etty's asking if there's a chat box that we can access. So for question and answer, you've already found the right box for that. So you can pop your questions in there.
All right, I think we'll make a start and people can continue to join as they wish. Well, welcome everyone, and thank you for joining us today to this Scleroderma and Raynaud's webinar. We are very pleased and honoured to be joined by Tani, who is a senior research nurse at the Royal Free and a PhD fellow at King's College London. She is here today to share about the patient's experiences of digital ulcers, particularly in scleroderma, which we know is a topic that a lot of you are very interested in, and we hope that you do find this very informative. So just a few rundowns about how this will go. So Tani will give us our presentation, and then after we will be taking questions. Some of you did submit your questions ahead of time. Thank you very much for that. So then we'll go through some of them that have not been answered by Tani in the presentation, and then feel free to submit any further questions that you might have in the question and answer that should be at the bottom of your screen. So let me just introduce Tani. Like I said, is a senior research nurse at the Royal Free and has worked with SIUK many, many times before. She is such a great presence in the community and has done a lot for patients over the years. She even started in 2012, the first nurse-led digital ulcer centre at the Royal Free Hospital. So she truly is an expert on this. You're really hearing from a top expert. And she has really championed so many different types of rare diseases and focuses on making great work with the patients at the centre. So Tani, if you would like to start and take it away.
Thank you, Annabelle. Can you hear me?
Yes.
Thank you for the introduction. So good afternoon, everyone. Thank you for joining us to talk about patient experience of scleroderma digital ulcers. This talk is surrounding my PhD study that I recently conducted. So people who have experienced digital ulcers have described digital ulcers with different words. Some of these words may resonate with your experiences, or there are others that you might think of that I haven't included in this. But here are the words. Some patients have described digital ulcers to be very painful, and some have said they are awful. And others have said they are evil because they can't sleep at night when they have digital ulcers. They are clock watching, time is not moving, and they are just in pain. They don't know what to do with themselves. Some have described them to be very, very sore. So the word is very, very sore. Others describe them as draining or exhausting because, firstly, you're not able to sleep, you're not able to do much because of the pain that you are experiencing, and to do even activities of daily living, it's all exhausting. And you also emotionally feel exhausted and drained. Some have said it is an ordeal. It's not a good situation. It's not a good experience. Digital ulcers are just awful. And others have said they are excruciating. The pain is just beyond thinking or even explaining it. And others have said it is just hell. Hell so much that they would just wish they could take an axe and just chop off that finger because the pain is just so bad. So here we're going to explore the different digital ulcer journeys, what they typically look like, and how the ulcers can affect daily life and emotions, and then how it feels, and common challenges patients with digital ulcers mention, and practical tips for managing the day-to-day life with digital ulcers, and also some tips that can help to lessen the digital ulcer occurring, and when to seek help and whom to seek help from, because sometimes it is confusing for patients, and working with your healthcare team as well. And self-care and emotional well-being is very, very important. And finally, we'll talk about the resources and support that is available for people with digital ulcers. So in the study, I found that some patients developed digital ulcers well before they were diagnosed with scleroderma. So if you can imagine, if you've developed these digital ulcers, you do not know what they are, what they are, and you go to doctors, and the doctors also, they do not know what they are. So the hardship that individual would face will be a lot, because firstly, they are confused, like what has caused this. Some patients reported that their healthcare professionals thought they worked a lot with their hands, so it had caused them to develop this. But this person was actually working in a cafe and they didn't do any hard work with their hair. They did work with their hands, but it was not hard work that it would cause them to develop these ulcers. So this prolonged the diagnosis of scleroderma as well, because this was the only feature that started, and because nobody knew firstly about scleroderma because it's rare, and then knew what caused the digital ulcers. It can take, for some patients, 3 to 5 years for them to diagnose with scleroderma and with the digital ulcers. And we know from reports that this is normal, that it takes a long time for scleroderma patients to be diagnosed with scleroderma. But nowadays, I would think that maybe it is getting better. Scleroderma is being recognized a bit more, but still, we have a long way to go. So still patients suffer quite a lot. Then number 2 and number 3 are those people that were diagnosed with scleroderma, and then they developed digital ulcers after the diagnosis of scleroderma. So for some patients, after they have often digital ulcers reoccurring in the background of the scleroderma journey. But then there are some patients that after the diagnosis, they will have a digital ulcer, and then their life continues. Scleroderma is still there, but they do not have another digital ulcer for a long, long time. And there is another group that I haven't shown in these diagrams, which are patients that have not developed any digital ulcers or that do not develop any digital ulcers. We know from literature that the scleroderma patients cohort, 50 to 70% of this population develop digital ulcers. So that means there is maybe 30% of people with scleroderma that do not develop digital ulcers. But the thing is, we can't tell who is going to develop digital ulcers and who is not going to develop digital ulcers. So that's why it's important to still look after your hands and also to be vigilant about knowing about digital ulcers, so that if it happens, then you know what it is, you know how to look after the digital ulcers. And also it is important that new patients that have been recently diagnosed with scleroderma are educated about digital ulcers so that they can be aware as well. So these are not exhaustive things that are affected by digital ulcers. They are just some of them. And I'm sure you will think of other ways how these ulcers affect your life. So digital ulcers can affect family relations. Some people feel isolated even when they are in a family because other members of the family do not understand what that individual is going through, or it may cause the affected individual just to want to be on their own because nobody really understands what I'm going through, so I would rather be alone and I can't explain how I'm feeling. I just feel I'm in a lot of pain. So it can affect social life. It will be difficult as well to perform everyday things like opening packets of food, eating, or even holding eating utensils can cause pain. It has been reported that digital ulcers affect functionality, as in people are not able to function in their normal way or even at work. For example, some people have got jobs that are, let's say, outside, like builders, and it's cold. And with digital ulcers, that gets even worse. And because of the Raynaud's attacks and the pain that they'll be going through, it can affect self-image as well, especially for women. It can feel embarrassing having these dressings on your fingers. I remember in one study that one participant reported that she was at a wedding, and a child innocently asked, "What is that on your fingers?" And that is embarrassing for the for the person who's affected. And also feeling shame in the appearance of digital ulcers are not nice to look at. So it can affect self-image. Because of the pain, it might result in people feeling down. Firstly, because you don't know what to do with the pain, and having too much pain and it's not being dealt with will just make you feel isolated and withdrawn. And even in some cases, people feel depressed. It may also affect, like when you are taking out money from the cash machine. I know these days we don't use cash machines a lot, but for some people, they are still using cash machines. So if you've got digital ulcers, it can be difficult even to press the numbers. and to take out the cash. And picking up coins as well is a nightmare for people with digital ulcers because it's very difficult. It will cause pain on the ulcers when you're lifting coins. And personal hygiene in the loo is affected when a person has got digital ulcers because you can't properly clean yourself, and it's painful even to lift up your pants when you've got, for example, digital ulcers on your thumbs. So things that we take for granted, but for people with digital ulcers, these are really, really big things, and digital ulcers can affect all these small things. It can affect your interests, your hobbies, because when you are in pain, you are not interested in anything. You lose interest in anything. And because pain is the biggest, it's the underlying thing with digital ulcers. That is the most thing that needs to be looked at, because when you have less pain, the ulcers might be there. You will be able to do some things, but if there is pain, then all these things, they affect your activities of daily living. Here is how digital ulcers feel like to some patients. It's time consuming. Here, it's about the time taken to change the ulcer dressings or time taken to look after the ulcers themselves. And as we saw, it can be draining because we've got other things that we are doing in life, right? So changing dressing is on top of the other things that we are doing. So it can take time. And also it's about time taken to travel to the hospital. Maybe you need to go to the clinic for the ulcers to be dressed or to have a follow-up. And that's time. And time taken to have the treatments. For example, some patients have to have infusions such as iloprost infusions. So that means you are spending the whole day in the hospital. You've left your other responsibilities for you to be able to have that treatment. And that means that is time spent. Another one said, I used to love my hands because digital ulcers can be disfiguring and they can leave permanent scars sometimes. So you look at yourself the way you were before and now with the digital ulcers, and you don't like your hands. And it's somehow tiring and draining, as we have already had before. It takes ulcers are emotionally draining and emotionally tiring. And this is on top of the daily responsibilities that we have in our lives. And I felt isolated, as mentioned before. Some previous participants reported that even though they were within a family, they felt isolated because nobody could understand what they were going through, and also they couldn't express what they were feeling because they didn't want other family members to be worried. And there is a lot I want to do, and there is a lot I can't do. So this is people reflecting on their what they could previously do, and now because of these ulcers, they are not able to do it. So some people were able to do swimming, they were able to do other activities, and now because of these ulcers, they had to scale back, and they are not able to do those things. It's really frustrating, yes, because you want to do some things and you're not able to do some things. You want this pain to go away, but this pain is not going away. So it can affect your emotions. It feels like a toothache that will not go away. This is what one participant describes. So it's there and it's constant and there is no rest. It's so difficult to share that feeling with anyone. And that's so true. And that is what causes for the people with digital ulcers to feel isolated and to feel down because you can't share what you're going through. These are some common challenges that patients with digital ulcers report from time again and again. Pain, as I've already said, that it is the biggest thing with the digital ulcers. Digital, digital ulcer infection as well is another theme that commonly comes up. Digital ulcers they can get infected so easily, and it is a challenge. Treatment challenges is another big thing because there isn't any one magic treatment that can treat digital ulcers. It has to be a combination of therapies. So, for example, some people have to take tablets and maybe have debridement and also wound dressings, and then maybe have iloprost infusions or other combinations of treatments. So it is a challenge. And another challenge with treatments is side effects from these treatments, because we are all different and we react differently to medications. So some people are not able to tolerate treatments. So it's a matter of trying things out, trying different treatments and seeing what works for you and what doesn't work for you. And if we are not able to take any treatments, then especially those that open up blood vessels, then it is a problem because now we are at high risk of actually developing digital ulcers because our Raynaud's is not controlled. So it's a catch-22 situation where there is no win. So it's about trying different medications to see what works. Wound dressings is another challenge because patients don't know they don't know which dressings to use because in the process of a digital ulcer healing, the dressings have to be changed according to how the digital ulcer is progressing. So, for example, if the digital ulcer is infected, you need to put wound dressings for infections. If the ulcer is not infected, it needs a bit moisture, it needs a bit dryness, so they have to be a balance. So all those things, it's a challenge when patients don't know much or they haven't been educated about dressings. Another problems with dressings is if you've got contractures, um, the thing is, it's difficult for dressings to stay. So you have to have a skill where you can cut the dressing in a certain way to be able to apply it and for it to stay. Color of dressings is another challenge in that most dressings are white. It's unfortunate. So when with white dressings, we use our hands for everything. So you see, in an hour's time, the dressing is gray or it's brown, but it is a challenge. And that's how it is, unfortunately, for now. I think we need to find a company that can make us brown dressings. They are there, but the stickiness of them is an issue. Whereas with all the white ones, most of the white ones, they can stick much better than the brown ones. Dry skin is another problem that is reported with patients. because with scleroderma, with the fibrosis that's happening on the fingers, and the skin gets very, very dry. So it's a challenge. And if the skin is not moisturized and you have trauma, we easily knock our fingers as we use them. And that also can cause digital ulcers to develop. So it is very, very important to moisturize your skin. We'll talk about it a bit later on. Contractures I've already touched. Sleep is another issue, which is the biggest problem if you've got digital ulcers and if you are in a lot of pain. That will be a big challenge. And if you don't sleep, we can't function. We need our sleep in order to function each and every day. So it's a common challenge. Emotional highs and lows, sleep deprivation can affect emotions, the emotions that you are going through when you are in a lot of pain, when the digital ulcer is active. And also because digital ulcers take a long time to heal. So when you see as if nothing is moving, that can also affect your emotions. Raynaud's phenomenon, I've already spoken a bit about it. So it's important for the Raynaud's to be managed, to be balanced, because if the Raynaud's is not managed well, that means you are susceptible to digital ulcers. Working is another challenge. I spoke about the building work, or even people that use a lot of their hands in doing work with digital ulcers that can be challenging. There is a lack of digital ulcer education out there, and patients have said it, and we are trying to do something about it. I'll talk about it in other slides. Digital ulcer services, we have only 2 digital ulcer clinics in the whole country. So not all patients have access to these digital ulcer services, which is a nightmare for patients because they have to find other means of looking after their digital ulcers, which is a struggle. It's a big struggle. And also when they contact the healthcare in their local hospitals or in their local primary care services, they don't know much about digital ulcers, and it's frustrating for the patients then when they are not able to be helped, or when they are given unhelpful advice, and sometimes not being taken seriously, because a digital ulcer can look like a small wound. So for a person who doesn't know about digital ulcers, they can take it lightly, that kind of small wound can be causing that pain. So, which is frustrating for the person who is actually experiencing it, because it is a big thing. It is affecting everything in their life. And another challenge is that was reported was when to seek for help. Patients want to self-manage their digital ulcers, but they do not know when to seek for help. And we will talk about that later. So I'm going to give you some practical tips of managing day-to-day life with digital ulcers, or even when you don't have digital ulcers, but looking after your hands. So small changes make a big difference. Keeping your hands and nails clean and your feet clean is very, very important. Some patients, they might develop the ulcers like under the nails, so they prefer to keep the nails long. Other patients find that they need to keep their nails short. And this is an individual preference. What works for you, as long as you keep your hands and nails clean and also moisturized and supple. That is very important. Moisturizing, I can't put I don't know how to put a real emphasis on the importance of moisturizing your hands, but it is very, very, very important. And keeping your skin supple. So what you can do is you can just buy some white cotton gloves, and maybe 2 or 3 times a week, you moisturize your hands before you go to bed. You put them in those cotton gloves and go to sleep like that. If you are able to do it every day, that's much better. And also paraffin hand waxing is very, very important. It's a treat. It's a nightmare at the beginning because you don't know how to use this machine and you don't know what to do. But if you persevere, you will see the effects, the positive effects of it, because it makes the skin softer, and it makes it also opens up the blood vessels, so it's helping with the Raynaud's. And also, if you've got digital ulcers, you can do paraffin wax, but you do not put your hands directly into the wax. Firstly, it will be so painful. And secondly, you might introduce infection to the open ulcer. So what I recommend is you do the waxing through latex gloves. And sometimes some wax bath actually comes with some gloves. So you can wax through the gloves, or you can put a cling film around your dressing where the ulcer is, and then you can do your waxing. But it is very, very important to keep your hands moisturized and supple. If you keep on doing it, it becomes a habit. Be kind to your hands. So all this looking after your hands, as in moisturizing and keeping supple, is looking after your hands. If you find that you've had an ulcer and it's now scabbed over, or it's healed, but the area is still sensitive, you can put just a padded dry dressing over it so that you do not knock it, because it's so easy to knock our fingers. So it is very important to look after your hands. Stop smoking. You're not helping yourself if you're smoking and you have scleroderma, because you are actually you are making it worse for yourself, because smoking closes the blood vessels, and we know with Raynaud's the blood vessels are closing and opening, and with smoking that makes it worse. So smoking is no good. Eat healthily and keep hydrated. High protein diet is very good for healing ulcers, and keeping hydrated is good for the cells that help to heal ulcers. Keep warm and use or put on warm maintaining clothes or gadgets. It's very important. In this weather, I would not expect to see somebody with Raynaud's or scleroderma putting on fingerless mittens. You need to look after yourself. And there are so many warm maintaining clothes and gadgets out there. Avoid tight-fitting jewelry or tight-fitting shoes, because that can be difficult when an ulcer develops. Or tight-fitting shoes can also cause rubbing, which can then open up as an ulcer. Organizing your dressing supplies in one place is very important, so you are always ready. If an ulcer starts, you know where your dressings are. You have your dressings. You don't start panicking. know your condition and spot early signs. It is very important for you to know about digital ulcers. And the more you know about your condition, whether it's scleroderma or digital ulcers, the more you know how to take care of yourself. And when you spot early signs of digital ulcers, you know you need to be alert. And when it opens, you start putting on your dressings and you are on your medication. Please, please, please avoid picking on your scabs or your ulcer. I know it's very tempting, and a lot of people feel that maybe picking up on the scab or on the ulcer will help it to heal. Actually, you are doing yourself a disfavor because that can introduce infection, and also it would disturb the ulcer because the ulcer, the wound, an ulcer is a wound, and it has to be in a certain environment, and it will be doing its own thing that it doesn't need disturbances. So you make it more harder for yourself, and it may take longer if you pick on your ulcers. And stop experimenting with unfounded treatments. There are so many things now on the internet that are not researched. So it's a hearsay thing. Please just follow the advice that you are given by real healthcare professionals. And because when we are giving you advice, it's things that have been researched on or things that we are sure that they might help. Once a digital ulcer opens, start applying suitable dressings. So we are producing a leaflet with the SRUK that is going to talk more about different dressings and how to do dressings, and that will be helpful. So putting on appropriate dressings is important. Change dressings as advised. According to what you're advised either by your nurse or your scleroderma nurse, follow those instructions. And sometimes it's difficult to keep those dressings. Let's say some dressings are for 7 days, but it might be difficult to keep it for 7 days. So you can have common sense to say, oh, let me change it in 3 days' time. That is fine, as long as you are not exposing the ulcer to infection. Change the dressing in a quiet and a clean environment. Ulcers are very easy to get infected, so you need time to focus while you're doing the dressing. There shouldn't be any like children or dogs running around because that can disrupt the process or that you'll be doing. You need to focus and it needs to be clean. Make sure your Raynaud's phenomenon medication are maximized. I think I've spoken about this already. It is very, very important. Be alert of signs of infection. I will speak about the signs of infection in another slide. If infection happens, seek help immediately because with digital ulcers, complications can happen quickly. So as soon as you know or feel that there is infection, seek for assistance. There are some patients that have got built relationships with their GPs already in that on their prescription. They have antibiotics prescribed so that when they develop an ulcer, they can just ask for that prescription. They don't have to see their GP because their GP trusts them that they will use the antibiotics appropriately, because we have to be careful that we do not take too much antibiotics and become resistant to antibiotics. So that's why either use them wisely or ask to be seen by your GP. Keep track of your digital ulcer healing process. It is very important. Our minds, we forget easily. We might have photographic memory, but sometimes we are not able to show that evidence, or we can't remember. So take pictures and track how your digital ulcer is healing. And sometimes if you speak to a healthcare professional, they might want to say, you're saying it's infected. Send me a picture on how it looks. And also even journaling is important so that you can track what is happening, what has happened, so that in the future, you might look back and see, oh, okay, this is what happened. Okay, now I can do this new situation. If in pain, take painkillers or seek help for stronger painkillers. Digital ulcers are excruciating. They are a nightmare. So sometimes paracetamol and ibuprofen won't do the job. Therefore, do not hesitate to ask for help for stronger painkillers from your doctors. If your mental health is affected, please seek help as well. Don't suffer in silence. You are not alone. Join support groups and talk to other patients that also suffer from digital ulcers. Don't just keep to yourself. It is a heavy journey if you are on your own, but if you are side by side with others, it makes things easier. Now I'm going to talk about how to tell if a digital ulcer is infected. There would be increased pain and throbbing, warmth or heat, or sometimes there will be fever. It will look inflamed, or there is increased redness. Sometimes it is quite swollen, and some patients have reported of smell or odor, and there might be some pus or some discharge. Sometimes you do not have to have all of these 6, but there may be some of them. But usually patients with digital ulcers know when it is infected. It is important to seek help when you know that there is infection, or if you suspect that there is infection. Infection needs to be treated immediately, as I have already stated, because complications can happen quickly with digital ulcers. If you are in a lot of pain and you are worried, then please seek help. And if it is affecting your mental health and you are really, really feeling low, please seek help, because you can be started on medication like fluoxetine. It helps with depression, but it also helps with Raynaud's. And sometimes it's not a matter of being prescribed more medication. It might be just to be referred for talk therapy. That helps as well. And also, if you are unsure, seek for help. You don't need to wait for something to become serious. Early reassurance can prevent problems. Whom to contact? GP is the first point of call because GP are the nearest to us, and also practice nurses. I would encourage you to build relationships with your practice nurses. They might not know about digital ulcers, but all nurses have been trained to have like basic wound management skills, so they will know about dressings. You can also seek help from your scleroderma specialist nurse if you've got one. and also the rheumatologist or scleroderma consultant through their secretaries and podiatrists. Some patients are seen by podiatrists, and other patients have built relationships with their tissue viability specialist nurses. So you can contact them. And if it is out of hours and you suspect an infection, then you can contact 1111. You are the expert in your own of your own body and of your own health. And the healthcare team brings their clinical knowledge, but your experience matters just as much. Good care is a partnership. And you might say to me, oh, they don't know anything about scleroderma, or they don't know anything about digital ulcers. But now we have weapons that we can use to educate them. So all this information resources that we are producing, you can take that to them, and for them to know that you actually know about your condition. So that will make them listen to you, and you can educate them. Ask questions, share your concerns, speak up if something isn't working. You deserve to feel heard. And it's not in an aggressive way or anything. It's just you are expressing yourself as somebody who is going through a hard time with these digital ulcers. Self-care and emotional well-being is very important. Emotional well-being is part of healing, and rest is very important. If you are not sleeping well, if you are not resting, then the situation gets worse. You're not able to function. Breathing exercises can be helpful. Fresh air. Pamper yourself. Why don't you buy a paraffin wax bath? It will help, firstly, as I've already said, with your Raynaud's. It will help to make your skin softer. It will also help to heal the digital ulcer because it's opening the blood vessels. Or go for a massage. And there used to be health spas where they used to do hand waxing. I don't know if they still exist. And also talk to others. Don't be on your own. Talk to others. Be kind to yourself. It is very important. There are resources out there. And Scleroderma helpline have got 365 days from 9 until 5 p.m., I think. There are online community through the Scleroderma website, and also support groups as well, and educational resources. Some hospitals have got resources that they have already produced, like at our hospital. We have digital ulcer leaflets that are on our website, which patients or people can have access to. Their open. SRUK have got some resources as well, and their YouTube channel have got different talks on digital ulcers and other things to do with scleroderma. Mental health, I can't put a lot of emphasis on it, but it's very important. If it is too much for you, you can gain counseling or talking therapy. Reaching out doesn't mean you are struggling. It means you are taking control of your well-being. So here are the key messages that I want you to take with. Your experiences are valid, and I'm sure you can resonate with some of what I've said. Digital ulcer journeys are different, so you cannot compare your experience with another. You can only walk side by side with them. Digital ulcer healing can take a long time, and it's not a straightforward path, but persistence and patience, as well as taking your treatments, can make the journey better and maybe quicker. You deserve clear information and supportive care. Hence, we are developing these resources to help you self-manage your digital ulcers in the right way and to increase your knowledge of digital ulcers. Small steps can make a big difference, so don't give up and know that you are not alone. Connect with other people with scleroderma, and seek support from SRUK and from your healthcare professional. Thank you for being here today, and thank you for your time and your willingness to learn more about digital ulcers. Your digital ulcers and your condition truly matters, and we are here to make a difference. And I'm here now to answer any questions you would like to explore.
Thank you, Tani. That was a very in-depth and well-researched presentation, and I took a lot away from it, and I'm sure so many other people did. Not that I can hear you at the moment, but I'm sure that everyone found that very interesting. There is already some questions come through, so I'm just going to put a few to you, but don't feel pressured to be able to answer everything off the top of your head.
Okay.
So someone's asked about after the ulcer is healed, the area where it used to be is still very sensitive. Is this normal? Is there always going to be long-term sensitivity after an ulcer is healed?
That is a very good question. So, digital ulcers are a nightmare, and for some patients, the healing of them, the healing of a digital ulcer comes from inside out. So just because it's healed, that doesn't mean that it's completely healed, because it takes a long time for it to heal from inside to out. So it can take some time for that sensitiveness to go away. And that is, I think I mentioned before that if it is healed and if it is still sensitive, then it's important to still keep it dressed. So just a dry dressing with padding can be helpful. And also some people, some patients have reported that they'll put like a thimble, I think a thimble, it's called a thimble, to protect them from banging it. So for some patients, it goes away after a while, but for some patients, they still have that sensitivity because it's destroyed the tissue, the outer tissue. So we can't know, like, is it going to go away? But the important thing is to protect the area.
Thank you.
Yeah.
So someone else has asked how they can prevent their digital ulcers getting worse during like their daily bathroom and getting ready tasks. You know, you need to wash your hands, have a shower, do your hair. They tend to find that's where it causes the most irritation.
Okay, that is very important because you've got a dressing on and it's important to keep it dry. And also because it's painful, so it needs to be, firstly, it needs to be dressed, and you might need to put a bigger padding so that when you are washing your hands, the ulcer is not as near to what you're touching, because you've got it's padded. And also put on like gloves. You might instead, let's say if you put medium gloves, when you've got an ulcer and it's dressed, put on large gloves and you can secure them, or put a cling film around the area and then put on gloves and then secure them so that water don't get in. And now there are some plastic that are used for people like with leg ulcers or with ulcers, with arm ulcers, that can be put on when somebody is showering so that the dressing doesn't get wet. You can find a lot of things on the internet these days, and also like those equipment, like the protective for legs or the ulcers, can be you can access them or advice from like tissue viability because they are more well experienced with those kind of things.
Thank you. So you mentioned that avoiding cold temperatures is a good thing as a way to help prevent digital ulcers, but does it make a digital ulcer worse and more painful when you actually have it to be in cold temperatures?
Of course it will, because remember, when your temperature changes, you have more Raynaud's attacks, isn't it? And for some people, Raynaud's attacks are really, really painful when there's no blood going to the fingers. So it's still the same. That is still happening even when you've got an ulcer. So it is very important to put on warm clothes and also put on warm things to keep your body warm and also your fingers warm. And hand warmers and all those gadgets like battery-powered gloves and stuff like that. They are very, very important.
Thank you. Staying warm is constantly the key to these things, I tend to find.
Yes.
So someone's asked about how quickly do you tend to proceed onto oral antibiotics? So while the digit is swollen and painful, but before an ulcer has erupted, or is this something more that's to each individual to be discussed with their doctor?
It's for each individual to be discussed with the doctor because sometimes infection, as I said, like a digital ulcer is from inside to out. So it might be underneath there already, but it's not opened, and it might already been infected, but it's not open, but you need antibiotics. And sometimes you need maybe lancing because there is pus already, but it's not open. So it's a matter of seeking help from a healthcare professional, your doctor.
No worries, thank
Yeah.
you. So someone's asked if there's any tips for managing digital ulcers specifically in the toes, or are they kind of the same as doing in the hands, or is there any extra special ideas?
It's the same as with the hands as the fingers, but I would also go a step further to say it would be good for you to be seen by a podiatrist because there might be other causes of those ulcers happening in the toes, not just digital ulcers, but there might be other causes. So it's better to know for real that it's just digital ulcers or there is something else. So,
Thank you.
yeah.
So I know you mentioned that keeping the hands moisturized and the feet moisturized is very, very key, but is there any particular creams, moisturizers that you recommend, or is it any and all are a good idea that work for you?
So with scleroderma patients anyway, we encourage them to use emollients. So moisturizers or emollients that are used for people with skin conditions are very, very good because they actually sink into the skin. So nothing perfumed, nothing that has got alcohol in it is important. And also, if you are washing or you are having a bath, it's better to use emollients rather than soap. And if you are washing your hands as well, use emollients. So anything that is good for people with skin problems or sensitive skin, it's good for you.
Thank you.
Yeah.
I do believe that's all we have time for today. I do know that there's a few other questions. We'll take a look at them and see if we can get back to you guys with an answer later. But I just want to thank everyone for joining us, in particular, Tani. Thank you again for that great talk and for answering those questions. It's been a pleasure to have you. Thank you, everyone, and I hope you have a nice rest of your day.
Thank you.